Have you ever wondered what the real cost of physical perfection could be? What are the hidden side effects of those miracle muscle-building steroids? Steroids, in the simplest terms, are synthetic substances similar to the male sex hormone testosterone. They are used in medicine to treat a range of conditions, including inflammation, autoimmune diseases, and certain types of cancer. However, their use extends beyond the realm of medicine, finding a significant place in the world of bodybuilding and sports. The allure of steroids in bodybuilding is easy to understand. They promise quick results, rapid muscle growth, and a fast track to a body that would usually take years of disciplined training and diet to achieve. The pressure to perform, whether on the field or on the stage, often leads individuals to resort to steroid use. It's an open secret in the world of sports and fitness, a shortcut to physical prowess and success. But let's pause for a moment and consider this. Is this shortcut worth it? Are these quick results truly free of consequence? If you've ever asked yourself these questions, then you're beginning to scratch the surface of the hidden truth about steroids. Steroids, like any other drug, have side effects. Some of these are immediately apparent, like acne and hair loss, while others are more insidious, creeping up on the user over time. The quest for that perfect body, the desire to push past natural boundaries, comes with a price. And that price is often paid in the currency of health. Steroids can have a profound impact on the heart, liver, and endocrine system, leading to a host of health problems that can be as mild as mood swings or as severe as heart disease and cancer. They can even impact mental health, leading to conditions like depression and anxiety. However, as with any shortcut to success, steroid use comes with a hefty price tag on your health. As we delve deeper into this topic, remember this: the pursuit of physical perfection should never come at the cost of your overall well-being. The physical consequences of steroid use are numerous and can be severe. Let's delve into the details. One of the most concerning side effects of steroid use is the potential for liver damage. Steroids are processed through the liver, and high doses over a prolonged period can lead to a condition called pileosis hepatis, where blood-filled cysts form in the liver. These can rupture, causing internal bleeding. Cardiovascular issues are another significant risk associated with steroid use. Steroids can increase levels of low-density lipoprotein, the bad cholesterol, and decrease levels of high-density lipoprotein, the good cholesterol. This shift in the balance of cholesterol can lead to a buildup of plaque in the arteries, a condition known as atherosclerosis. This can cause heart disease or even a heart attack. Changes in blood pressure are also common with steroid use. Steroids can cause both high blood pressure and a condition known as blood clotting, which increases the risk of stroke. Moving on to the kidneys, these organs work to filter waste from your blood, and steroids can put them under immense strain. Over time, steroid use can lead to kidney disease or even kidney failure. Finally, but by no means least, is the increased risk of infection due to needle use. Injecting steroids can lead to skin infections or the transmission of infectious diseases if needles are shared. Not to mention the risk of abscesses if the injection site isn't properly cared for. As you can see, steroid use isn't just about getting bigger muscles or improving performance. It's about putting your body under extreme stress, and the outcome can be devastating. Each of these side effects is serious on its own, but combined, they pose a significant threat to your health and well-being. The damage these substances can inflict on your body is profound and, in many cases, irreversible. The harm steroids can cause isn't limited to the physical realm. They can wreak havoc on your mental health as well. Let's delve deeper into the psychological impact of steroids. Steroid use can result in a range of mental health issues, varying from mild mood alterations to severe psychiatric disorders. The most common psychological side effects include mood swings, aggressive behavior, depression, and even suicidal thoughts. Mood swings are often the first psychological side effect to emerge from steroid use. Users may experience rapid shifts in their emotions, going from extreme highs to devastating lows. This emotional rollercoaster can be disorienting and distressing, not just for the user, but for those around them as well. Aggressive behavior, often referred to as roid rage, is another significant psychological side effect. Steroid users may become excessively irritable, prone to fits of anger, or even violent. This aggression isn't just confined to physical outbursts. It can manifest in verbal hostility, creating a toxic environment for everyone involved. Depression is another serious psychological side effect. Steroids can induce feelings of sadness, hopelessness, and a lack of interest in activities once enjoyed. The link between steroids and depression is especially concerning, as it can persist long after steroid use has ceased. The most extreme psychological side effect is the emergence of suicidal thoughts. Steroids can distort a person's perception of reality and self-worth, leading some users to contemplate or even attempt taking their own lives. This is a heartbreaking consequence of steroid use, one that underscores the severity of its psychological impact. It's important to understand that these psychological effects are not isolated incidents. They are interconnected, each one feeding into and exacerbating the others. A person suffering from roid rage may subsequently fall into depression, which could then trigger suicidal thoughts. These psychological side effects can deeply affect not only the user, but also their loved ones. The ripple effect of steroid-induced mental health issues can extend far beyond the individual, impacting families, friendships, and communities. It's a stark reminder of the hidden costs of steroid use, costs that are all too often overlooked in the pursuit of physical perfection. Beyond the physical and psychological, there are other, less visible side effects to consider. Steroids can induce a whole host of issues that are not immediately apparent, but just as serious, if not more so, than the ones we can see. Let's talk about hormonal imbalance. Steroids are synthetic versions of hormones, and when you introduce them into your body, you're essentially throwing your hormonal system into disarray. You might think, what's the big deal? It's just a little extra boost. But our hormones are delicately balanced, and even a slight disruption can lead to problems like mood swings, insomnia, and even depression. Then there are reproductive issues. In men, steroids can lead to decreased sperm count, shrinkage of the testicles, and even impotence. Women may experience changes in their menstrual cycle, enlargement of the clitoris, and deepening of the voice. These effects are not just inconvenient. They can be life-altering and deeply distressing. Steroids can also impact your personal relationships. Mood swings and aggressive behavior, a common side effect of steroid use, can strain relationships with family, friends, and colleagues. It's not just about you, it's about the people around you too. And let's not forget about the risk of dependency and addiction. Steroids may not be typically thought of as addictive, but they can be. The desire to maintain the gains achieved through steroid use can lead to a cycle of use and abuse, leading to physical and psychological dependency. This can result in withdrawal symptoms when trying to quit, including fatigue, restlessness, loss of appetite, and even depression. The unseen side effects of steroids can often be the most devastating ones. So the next time you're tempted to reach for that quick fix, remember these unseen risks. Because what you can't see can hurt you. So is the quest for physical perfection worth the multitude of side effects that accompany steroid use? This question brings us to the crux of our discussion. We've delved into the hidden truths, the physical toll, the psychological impact, and the unseen side effects of steroids. Now it's time to summarize these points and offer a clear perspective on the implications of steroid use. Steroids, while notorious for their muscle-building prowess, carry a hefty price tag when it comes to health. Physically, they can wreak havoc on the body, leading to acne, baldness, heart disease, liver damage, and even increased risk of certain cancers. The physical toll is undeniable and far-reaching, potentially affecting every system within the body. But the impact of steroids is not just confined to the physical realm. The psychological effects can be equally, if not more, detrimental. Mood swings, aggression, depression, and even suicidal thoughts can be part and parcel of the steroid package. Steroids can alter the brain's chemistry, leading to an array of mental health issues that can persist long after steroid use has ceased. And let's not forget the unseen side effects, the ones that are not immediately apparent but can have a profound impact on quality of life. Infertility, impotence, Stunted growth in adolescence and a higher susceptibility to infections are just the tip of the iceberg. These side effects can manifest themselves months or even years after steroid use, underscoring the long-term risks associated with these substances. The bottom line, the potential risks of steroid use far outweigh the temporary gains. The quest for physical perfection, when pursued through shortcuts like steroids, can lead to a host of health problems and a significant decrease in quality of life. Remember, true strength doesn't come from a pill or an injection. It comes from discipline, hard work, and a commitment to health. So before reaching for that quick fix, consider the long-term consequences and make the choice that supports your overall well-being.